This individual is in Canada. He's a Canadian creator. He comes from I would say he identifies more on the left side of politics, talking about kind of what the premiers are up to with healthcare in this country and what their plans are for healthcare in this country. And we're going to play this out, let him talk, and then we're going to break down the conversation here.
Doug and his fellow Conservative premiers continue to break healthcare in Canada, and the scheme is becoming more obvious, as they're beginning to upcharge people who are getting surgeries out of province. So this story follows a man who had an extensive wait time for surgery in Ontario. So he went to Alberta, since he'd been on a wait list for more than 3 years for shoulder surgery. He was in significant pain, so he decided he had to get something done. He went to a place called Canadian Surgery Solutions in Calgary, and he was charged $28,000 as a non-Albertan resident. He was under the impression that his surgery was going to be covered by OHIP. It wasn't. So OHIP told him that he would be receiving a percentage of the cost, but what he actually got was $1,821. So not even a tenth. Why? Because it's not a publicly funded hospital, and because those charges are considered facility charges. Now, this is happening right at the same time as Health Minister Sylvia Jones is saying that we're going to lean more on private surgeries. Although she said, quote, "They will always be paid for with your OHIP card, never your credit card." Except for this case where he has to pay for it with his credit card. Because he says that the entire cost should be covered because he couldn't have it done in Ontario. He said, quote, "I've been working my whole life paying into OHIP, but when I had to use it, it wasn't there for me." And that's the heart of the problem. People are being charged for services they've already paid for. So how did this happen? Well, this is the heart of the scam that the Conservative premiers are setting up. They figured out that these private health clinics can't overcharge in-province residents, but they can overcharge out-of-province residents. So that's what they're doing. They're sending all of these people needing healthcare to other provinces to overpay. In this case, going from Ontario to Alberta to pay $28,000 for an operation. But governments are funding it too. Like Saskatchewan's spending $2,000 a scan to send people for mammograms to a private clinic in Alberta, even though in Saskatchewan that costs about $200. Same thing with knee and hip surgeries. Send them to Alberta, overpay. Because the Health Act says that you can't be upcharged for services that are offered by the in-province healthcare system. But if you send somebody out of province, then they can be upcharged. And the grift cycle continues. Because this is the game. Break the in-province system, replace it with private clinics, and then shuffle patients from province to province so you can rip them off. This isn't a solution. This is a rip-off.
So that's a big statement. To come out and say the premiers in Canada are all conspiring together to get private healthcare instituted in the country is a big statement. Not saying not saying that's not true. Not saying that it is true. I'm just saying that's a big statement to make off of very little information. But Reg is our resident healthcare man here on the show. What are your thoughts when you read this or saw this?
So I say this is BS. First off, that is not the mandate of Conservative government. So first off, I like Steve. I like watching his content. I follow a lot of it. I agree with a lot of it because I'm more left leaning. This is kind of a crappy take, I'll say, just because one, he emphasizes that the Conservative premiers in the country are trying to break healthcare, and then gives these examples. And what's interesting is that when you actually look at the healthcare crisis across the country, it's the same thing. It's lack of doctors, lack of access, lack of physical space, the amount of administrative burden that was put on them through COVID. It's just everyone's burnt out. There's not enough actual physical spaces to hold people. There's not enough physical clinics to actually see people, that they're just shuffling people wherever they can get them to have care so that their citizens aren't in pain or aren't waiting. Because when you look at the fact that if you delay a scan for something and then that goes undetected and then it gets worse and worse over time, the actual healthcare costs are going to way outstrip the $2,000 that you spend on the scan. So I think that it's a bad take. It's a take from somebody who is obviously not embedded in the healthcare system and doesn't see behind the covers, because that is not the plan for the governments across this country in these provinces. And specifically speaking about Nova Scotia has poured millions, hundreds of millions more into its healthcare system to update it, to make it more accessible, to actually connect systems. And I get to see that every single day, which is really, really cool. So that's why I always get defensive when I see these kind of comments come out, because the work behind the scenes is immense, and it's actually groundbreaking. And especially for Nova Scotia, we had conversations with different industry partners, and they've said, like, Nova Scotia is leading the country right now in healthcare because we've invested in it. And that's a Conservative government that's investing in healthcare because they made it their mandate. Now, I can't speak for what Saskatchewan and Alberta are doing. I know that Alberta is very big on privatizing everything. So privatizing healthcare just seems like a classic move for them, and they've talked about that a lot. The problem is when you set up a two-tier system like that with public and private always just cannibalizes the public system until you have nothing left, because then you have all those private healthcare workers are now coming from the public system, and they're just charging exorbitant rates, and it's always going to cost more for the average person. So yeah, I think this is the wrong take. The take should be healthcare in Canada is a broken system, and that we're seeing provinces using other provinces to try and fill in the gaps. And what we need is actual federal healthcare coming from the federal pockets that are lined with cash, that they can give it away to GC Strategies, to the Philippines, to the We Charities, to the SNC-Lavalins, that they can give it away to everybody else. They should be putting it into healthcare, and they should actually have a national healthcare strategy, but we don't.